Hello everyone. Today we are going to discuss about one of the very important topic in obstetrics, that is about hypertensive disorder in pregnancy. And in this video we will be talking about general introduction and the basic or the terminology that are important in hypertensive disorder of pregnancy. And from next video we will be talking in detail about specific hypertensive disorder like pre-eclampsia, eclampsia, gestational hypertension, and so on. So in this video we will be talking about general definition and introduction. So first of all, talking about what is hypertension in pregnancy. It is known as the hypertension in pregnancy is defined as the systolic blood pressure that is more than or equal to 140 millimeter of mercury, or diastolic blood pressure more than or equal to 90 millimeter of mercury, or both of these. And while measure 2 times with at least 4 hours apart after 20 weeks of gestation. And that was about hypertension in pregnancy. And what is proteinuria? The urinary excretion of more than or equal to 0.3 gram protein in 24 hours, or urine protein creatinine ratio of more than 0.3 milligram, or dipstick more than or equal to 1 plus is known as proteinuria. And what is gestational hypertension? The hypertension developing after 20 weeks gestation in the previously normotensive woman with no proteinuria and sign of in-organ damage is known as gestational hypertension. And the pre-eclampsia means the gestational hypertension with proteinuria, and pre-eclampsia might be severe or non-severe. And the eclampsia, basically eclampsia is the pre-eclampsia with seizure. It is the grand mal generalized tonic-clonic seizure with or without coma in women who have pre-eclampsia. What is HELLP syndrome? It is acronym for hemolysis, elevated liver enzyme and low platelets, and it is characterized by as more severe from a pre-eclampsia, although it can be diagnosed without hypertension and or proteinuria too. And the chronic hypertension is defined as the systolic blood pressure is more than 140 millimeter of mercury, and or diastolic blood pressure more than or equal to 90 mmHg, and that is present before 20 weeks of gestation. And in the gestational hypertension or gestational hypertension, preeclampsia, eclampsia, the criteria was that this increase in blood pressure level was after 20 weeks of gestation, but here in chronic hypertension means the increase in blood pressure is before 20 weeks of gestation and it persists longer than 12 weeks. But in gestational hypertension, it doesn't persist being beyond 12 weeks, it is less than 12 weeks. And there are various different causes of chronic hypertension. One is essential hypertension, majority of the cases, chronic renal disease, coarctation of aorta, endocrine disorder like diabetes mellitus, pheochromocytoma or thyrotoxicosis, and connective tissue diseases like lupus erythematosus. The criteria for the these are the causes of chronic hypertension. And the next term we have the superimposed pre-eclampsia or eclampsia. The occurrence of new onset of proteinuria or end organ dysfunction in women with chronic hypertension is known as superimposed preeclampsia or eclampsia. That is occurrence of new onset proteinuria or end organ damage in the woman with chronic hypertension. And in this woman, if there is new onset of proteinuria or end organ damage, that is called as chronic hypertension. And the criteria for diagnosis is new onset of proteinuria more than 0.5 gram per 24 hours specimen, or end organ dysfunction after 20 weeks in women with chronic hypertension. And next is aggravation of hypertension, development of HELLP syndrome, development of headache, scotoma, epigastric pain, and the risk of preeclampsia is 20 to 25% in this condition. So that was all about introductory part, and in next video we will be talking about preeclampsia in detail. Thank you. Till then, have a good nice day ahead.